Hi, I'm Dr.YVRao, plastic and cosmetic surgeon from Dr.YVRao Clinics, Hyderabad and Vizag. Today I'll be mentioning a few points about microtia and anotia. So normally if you see a ear which has three parts, external ear which is called the pinna, the middle ear which has got some neuroectodermal tissue, and the inner ear which has some connective nerves tissue which will be connecting to the brain. That means they conduct the sounds that we receive are transmitted or modified by the middle ear and then transmitted through the inner ear to the brain to perceive what it is or what type of sound it is. So what we are concerned as a plastic surgeon is mainly the external ear, that is the outside the pinna. If it is a partially lost, it is called microtia, and if it is a totally lost, it is called anotia. So normally it happens 1 in 5,000 live births, and there is no exact cause known. Some attributed to the high altitude, some due to lack of vitamin deficiency during the first trimester of the pregnancy, that is the first 3 months of the pregnancy, and some may be associated with the familial also. If anyone having in the family also, they can be, the next sibling can have the predisposition for the development of this microtia, and so many other put forward. But so more than so there is no significant or rather proved cause for the development of this microtia or anotia. But the clinical features, that means why it's obvious, either partially lost or totally lost, which can be graded into 4 grades depending on the type. If it is almost near normal with only mild decrease, maybe I can say 25% decrease in the size, is called grade 1. If it is more than around 50% or so with significant deformity and then only remnants present, that's called are totally present but very small in size, maybe in less than 50%, that's called grade 2. And if it's more than that one and only very small part, either the lower part or the only upper part, if it's present, that's grade 3 with absent ear canal. Whereas in the first 2 categories, the ear canal is present and patient will have a normal hearing. Whereas in grade 3 and grade 4, it can be associated with loss of ear canal and middle ear and inner ear also. So where there will not be any hearing on this side, but there will be normal hearing on the other side. So today we'll be operating on a patient where she's around 23 years old, and she came for a reconstruction of the ear. Unfortunately, this microtia can be associated, that means it can be isolated, and most of it is isolated only. And it can be syndromic also. Syndromic means it can be associated with other features, that is other abnormalities in the body, for starting from nervous tissue, that is brain, or from the heart problems, or even others, rest of the face also. So because ear is developed from branchial arches, that is called first and second branchial arches, which they start from here and then they fuse it, like they migrate and fuse it. Any delay or any suppression of this migration or decrease in the speed of the migration can cause some development of either that side of the face or the ear also. So this patient has associated hemifacial microcephaly. That means one half of the face, the left half of the face is underdeveloped, and the nose and the mouth are shifted slightly to the left side with absent external ear, that's called the pinna. So we'll be operating, and we have taken measurements from the opposite ear, and then we are trying to superimpose on this side and then try to create here. So it's usually done in 2 or 3 stages. First stage, we take ribs from the cartilage from the chest. Usually the 6th, 7th, 8th and 9th, the 4 ribs, whereas the main block, that is the base plate, is formed from the 6th and 7th, whereas outer curvatures and some other things are formed from the 8th and 9th also. So first we create a pocket here, place the cartilage here, and after 4 to 6 months, we raise it, lift it up, and put another piece of cartilage and put take a small piece of skin graft or a small flap from the scalp, and then place it backwards to lift it up. So first is creating the block mold, and second stage we give projection to the ear, and any minor corrections later may be required in the 3rd or 4th stage. So చాలు ఫ్రంట్కి తిరుగు. యా కళ్ళు మూసుకో, బాగా మూసుకో, గట్టిగా మూసుకో. పైకి ఐబ్రోస్ పైకి లేపమ్మా. గుడ్. I created a pocket here, and now the remnant, that is whatever is the left behind cartilage, I'm trying to remove and preserve it for future use. At the same time, discipline lobule also to keep the cartilage in this whatever that created cartilage that we have. So this is the piece of. So hold it. So be careful not to cause any buttonholing. This what I will see is that cartilage may get exposed. So the flap should be moderately thick. If it is very thin, it can expose the cartilage because of the necrosis of the skin and overlaying it. So remove this part of the cartilage into this. This is rudimentary and it's not useful at this stage. It should be very fluffy so that there will not be any compression also. It will give a mild compression garment, but not severe enough to cause any blood supply vascularity compromise. So keep a dressing box and then some glass pieces.